Hello and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Susan McLennan and Dr. Stephen C Moyo from WELFIE. Welcome to this interview, Susan McLennan and Dr. Stephen C Moyo. It is an honor and a pleasure to have you with us today.
Thank you so much. Happy to be here.
Yeah, thank you for having us.
Great. WELFIE is a collaborative effort spearheaded by our guest today, aiming to revolutionize healthcare access for marginalized communities through innovative tech solutions and engaging in educational content. Their initiatives have won acclaim, including selection at the American Public Health Association Film Festival 2023 in Atlanta, Georgia. Susan McLennan is a visionary leader, co-founder, and co-chief marketing officer at WELFIE. She brings a wealth of experience in creating impactful digital projects and television shows, focusing on education and health awareness. Dr. Stephen Moyo is a medical doctor and the co-founder and chief executive officer. He brings his medical expertise and passion for community health and aims to bridge the gap in healthcare access for marginalized families and advocate for health education. My name is Dr. Pietro Aparicio from 72 Dragons Health. Thank you for joining us and for sharing your experiences with us today. Without any further ado, let's begin. So let me ask you both, what inspired the beginning of WELFIE and what core principles guide its missions and operation?
Yeah, that's a great question. Thank you so much for asking. For me, WELFIE really is rooted in who I am as a person. So I like to say I'm a three-time immigrant. I was born in Zambia, moved to the UK and grew up in Canada. And it's actually when I came to the US during my medical school training at Michigan State University as part of a program called Leadership in Medicine for the Underserved. During this program, I had the chance to work in communities such as Flint, Michigan, Saginaw, Michigan, but also abroad in places like Peru and El Salvador. And in each of these communities, I worked hand in hand with community health workers. And I really saw the impact that community health workers can have on families that are underserved, families that are marginalized. And so this was a formative experience for me. I took this work with me to the Johns Hopkins Hospital in Baltimore, where I did my residency, and again to UCSD San Diego, where I work as an attending physician. And it's here in San Diego that I do a lot of work with community health workers out in the community. And I really saw how hard they're working and frankly, the lack of tools that they had. And so WELFIE was really founded as a health equity platform to empower community health workers to connect with and care for families. We particularly focus on families with young kids. And truth be told is when I met Susan that she kind of turned my world upside down. As an internal medicine doc and as a physician who focuses on adults, it was my approach to really think about getting to the family through the parents, really the mom. Susan, in her experience, which I'll let her share, really surfaced this philosophy that if you want to impact and change the family's dynamic, you go bottom up through the child. And so that's what we started to do. And so today we work closely with K through 12 schools and camps, really with the mission of increasing or creating generational health and wealth for these families, and doing so through this community health worker or community-based workers as a vehicle for health education, as you mentioned, and increase access to care.
Great. Quite a journey.
Yes. Steve is a visionary founder, and I'm so glad to be working with him. And it's not every founder who can take their vision and bring other people's experience in so beautifully. And I'm really grateful for that. And my experience, actually, a lot of it comes from children's television. So I worked with a number of children's television properties, but particularly I spent a fair bit of time working with the Kratt brothers, and they have shows like Zaboomafoo and Wild Kratts on the air that really bring science alive. And my husband and I worked on other science shows as well. Mike Erskine Kelly is my husband and writing partner. And I was working with the Kratz, and we were doing something where we had a very small budget, no budget actually, but really needed to make a big impact to have a lot of things happen, including trying to find a corporate sponsor, trying to get PBS to really embrace the show and greenlight a second season and help us with funding and all of those great things, and not having a budget to do what we needed to do. Chris and Martin said, because they're very smart with their audience, and they said, what we'll do, and what we do is tag our shows and just talk directly to the kids, not do a traditional PR marketing campaign to the parents. And the result was that instead of getting, 1,000 people that you might get by going down through the parents, they get 30,000 kids showing up to their shows, or in the big public events, outside. 10,000 is not unusual. Huge venues they can do, and it's all because they speak directly to kids. And we found, I saw over and over, that if you engage the child, the whole family comes along, because every parent wants to be the hero that their kid sees them as.
Wonderful. So it sounds like a great match between all this medical knowledge and the television experience and working with children and animation. Sounds wonderful. So what successes and challenges have you encountered while implemented WELFIE's programs, and how have you overcome these challenges?
Yeah, that's a great question. I'll talk first, I think, from the successes piece, and I'll let Susan share some of the things that she's been intimately involved with. For me, the success is really what the impact is on the youth that we work with. One of the key things that we hold dear is co-collaborating and co-creating with youth along the way, getting their feedback from everything from pre-design, character development, through animation, music, and then the actual end product. And so, I had an experience after one of the pieces of content we created called 4th of July. It tells the story of one of our characters, July, who crash lands on a planet in her spaceship, along with her companion Norm, who's our talking penguin. And she has to deal with social isolation, mental health issues, depression, while trying to figure out the gravitational force equation to get her rocket ship off this planet. And, we created the music, we wrote a song, and it's a fantastic, fun music video. But it was when I was at a school here in San Diego, played it for a girl who's in 4th grade, and she took the headphones off and she turned to me and said, "That makes me feel like I can do anything." That moment to me was like the ultimate success, because it showed that the hard work and the medical knowledge, the creative acumen Susan and Mike bring, and the entire creative team really was cutting through all the noise and delivering the message, and more importantly, I think the feeling that we wanted young children to have. So that to me is kind of the number one success, and we're really just looking to multiply it.
Yeah, I'll add to the success, and then I'll throw in a challenge. But I would agree that, for me too, it's hearing from kids who've engaged and working with them on it, to watch the synapses fire and for them to come up with great ideas. And then we are also working with interns. So we actually co-created Booster Troop with smaller children, but with we also involve older children. We found that older students, Sometimes they're shy about sharing their own experience or engaging peers on a peer-to-peer level, but they all love helping their younger siblings, their younger cousins, their younger versions of themselves. Everybody's trying to save a younger version of themselves from what they went through, right? And so the interns that we work really closely with, honestly, some days my job is just to sit back and capture wonderful ideas and to ask questions that help them lead to new ones, to new thoughts and new experiences that they can contribute. And they're just a fabulous group. And part of what we want to do is help students see themselves in medical careers. So that's a big part of what we're doing, is providing that modeling and those opportunities through our Hero Academy, where our students can actually see themselves in medical careers and even do some job shadowing. So I think that's a success. On the challenge side, I would say, 2% of funding, when you're looking for investors, 2% go to Black-led companies, 2% or under to Black-led companies, or to women-led companies. And when you have both, funding is really a challenge. So, how we have overcome that is we've had funding, which is good. We would like more. I think how we've overcome that is bootstrapping and just going to market and getting revenue in that way. So, Steve, anything to add on that front?
No, I agree with you. I think the funding is key. The quality of work that and the standard that we hold ourselves to is high. And so I think it's easy today to create content, especially as you look at generative AI solutions and things like that. It's actually still really hard to create high quality content that cuts through the noise. And so we hold ourselves to a higher standard. So that continues to be, I think, a challenge. I think the other challenge, but this is one we wholeheartedly embrace, is we're an equity platform. So what does that mean? It means that when we design and create content, we don't want to just do it for English speakers, right? We want to do it, everything that we do moving forward, we try to do in English and in Spanish. Would love to add more languages. It's an opportunity, frankly, to leverage some of those generative AI technologies to expand our reach. And this is one of the reasons we actually focus so heavily on animation, right? The ability to sort of dub into different languages, the ability to version and create different environments behind our characters, but still tell the same story. What that allows is for different cultures, different ethnicities, different races, different places to really see themselves in the story, which helps the story move along and get the message across. And so it's a challenge to do that. It means you have to move slower. It's not just, putting out content every day, but it is putting out content with a broader reach, and that is more inclusive. And that's really an important challenge that we take on.
And one of the things, too, is that non-English speakers often learn through cartoons. They learn English through cartoons. It's a very non-threatening, and they'll often do it while they're with their children. People think children's animation, all that. That's a whole family of that. If you do it right, it's not just kids who watch. The whole family watches and engages, and they reenact these things. If you do, they take on the characters and they go, our job is to actually create animation that matters more when the screen is off. Right? It's not even when the screen is on, it's when it's off. What does it inspire them to do? How do they take action? How do they go out and live in the world with what they've learned with our help? That's really the key.
Great. Thank you for sharing. Yes, it's a very creative space, but as you mentioned, it's also very challenging. Now, please share with us about Booster Troop, which was showcased at the American Public Health Association Film Festival. Can you tell us a bit about Booster Troop?
Susan, I'm going to let you go first on this one.
Oh, sure. Yes, so Booster Troop came out of an initiative. We participated in the Vax Up Challenge through the Children's Hospital of LA, CHLA. And it was a really fun collaborative process with the fabulous community of KIP SoCal. And we had the chance to work with those kids and really kind of design something that spoke to them. We really wanted it to speak. The challenge was that kids, that families with kids aged 5 to 11, they were not getting those 5 to 11-year-olds. They're not getting them the booster shot. They felt that if one shot didn't do it, then it wasn't effective. And it also outlined kind of an issue with trust in between underserved communities and the medical communities. So we wanted to create something that would kind of help address those issues. So Booster Troop is about a kind of a plucky band of action hero kids that band together to really fight misinformation and to promote better health. And they're intergalactic travels, and they have a talking penguin named Norm, as Steve talked about, and they go on great adventures and really engage kids in their own sense of health and well-being.
Yeah, and just to add, you mentioned at the top of the conversation that we are creating technology as well as content. And the two go hand in hand. We really see content as preventive, right, to deliver health education, increase health literacy, but also as an intervention. And when we say that, it's not just creating content to educate and entertain, but how do we get youth and their families to measurable healthcare actions and outcomes? And so for us, Booster Troop, while it started with this concept around media literacy and how do we understand the information around us, which is perhaps one of the most important lessons that we learned during COVID-19. But it really immediately, when Susan sort of brought the idea to me, I saw it as a vehicle to say, we can use this around any health adventure, right? We can tell a story around blood sugar and diabetes. We can tell a story around mental health, which we've done, and we're going to continue telling those stories. But we can really use this as a vehicle to have impact and reach youth, which is per our philosophy, but also reach the parents. And so I have a 3-year-old. Every time he sees me sort of watching it, getting an updated edit, he stops and will literally pull me out of my chair and sit down and watch it. But it's a really great experience for me to be able to one, see his response to it, but two, be able to talk to him about what those characters are doing, because I'm deep in the message behind it. And so that's how Booster Troop came to be and sort of how it continues to live, and we continue to push it forward to thrive.
Great. And so it sounds very, very, very creative, the way that you guys get these productions completed. And so what is your process? Also, how do you go about choosing the topics for your film productions?
I think in anything that we do, we start with the problem that the youth are facing. And even though if we hear it from an adult, we go and speak with youth and to try to really understand what the problem is. And often they end up reframing it, right? It's not, it's not, hey, we don't want the vaccine. It's we don't understand enough information about the vaccine. That 4th grader that I told you about earlier, I had a really great conversation with her, and she told me, my family gets information about the vaccine from, this news channel, right? And that's the only one. And I asked her, has any health professional come and talk to your family or your school about what's happening right now? And she said no. And that to me is a huge loss, right? It's a huge gap because she's not getting the information, her family's not getting even diversity of information that they need so they can make an educated decision. And so I think that is just critical in terms of what we're doing and part of our process. So getting that youth voice very early on and then engaging them through the entire process is key as well. Susan?
Yeah, and I would add our partners. We really want to serve the whole of the community, the public health community as well. So we are engaging our partners and saying, for example, with a large hospital that we hope to be working with, a pediatric hospital that we hope to be working with in the coming new year, or we expect to be actually. But the finding out what's for them, their emergency room is overwhelmed, and they're seeing events in their emergency rooms that they really shouldn't be seeing there, right? So trying to look at creating content that will really empower families, help families to better understand what they're going through, better manage what they're going through, and even have a language for what they're going through, and helping to remove some of the stigma around talking about all this stuff. That's absolutely critical. So understanding kind of a whole family understanding, a whole ecosystem understanding from the provider to the family, to the child, to the school, trying to bring all of those perspectives to bear, making sure that everybody has a seat at the table. And picking those subjects that are hard, that are really difficult. That I think that's our sweet spot, is taking the things that people struggle to engage with and making them super understandable, because people trust what they don't have to think about. And our job is to really make that easy and understandable and engaging and fun.
Yeah, I couldn't agree more. And I think there's one other key piece of the process that I think is really important, which is how we center culture. So for our first sort of episode of the Booster Troop, it was set in LA County. And so we wanted to make sure that those characters that were going to be the initial characters of Booster Troop were representative of that county. So we have one young African-American girl, 2 Spanish-speaking kids, and we went to the distance of making sure that the dialect of Spanish or the accent of Spanish that they had was appropriate for that region. And so I think that really sort of drives home how we center culture. And then with our second music video, 4th of July, I mentioned July as African American. As we wrote that song, it was really important for me to bring in elements of African American music. I thought the low-hanging fruit would be to choose hip-hop. Well, actually, I decided to take a left and actually focus on house music, because house music, not a lot of people know, but was born in Chicago, was born in the Black community in Chicago, and has a deep history and roots there. And so it allows us to bring in these cultural conversations, or at least make these cultural nods to certain communities while involving all communities at the same time.
And Steve's being way too modest. He wrote the song, and also he's a fantastic rapper. I mean, what more could I ask for?
There's a lot of qualities in one person.
There's a lot of qualities in one person.
Great. So it sounds like you guys are doing an amazing work. So what are your primary goals or aspirations for WELFIE and your other future ventures?
Yeah, that's a great question. I'm gonna go broad here and give my usual answer, which is my vision is to see WELFIE as an international, what I call a public health utility, which means that when people reach for a health need, that they come to WELFIE and they find something that speaks to them, not only their age, but their race and in their language. I use the word utility because I think of it like electricity, right? You want the light on, you reach for that light switch. That to me would be the goal. I think how we get there starts with health education. I think it starts with Booster Troop and other pieces of content like it, because that can live in every school in this world, right? Whether it's a video format, audio format, on paper, stories just being told, right? Getting right back to the pre-technology days, but are still so important. To me, if we can deliver those stories to youth around the world, we really do have an opportunity to deliver health equity, improved health literacy to youth around the world. And how that can impact families, how that can impact communities as we move forward, is not only an emotional draw, but is, for me as a physician, it's scientifically proven. We know that the earlier we deliver these aspects of health education to individuals and even families, the higher and more the impact that we can have. So we just need to start investing our time and our energy there.
And for me, I would say, kind of my vision for the future really aligns with next year's theme for APHA and the conference, and that is rebuilding trust in science and in public health. Right? I think that's a huge part of our mission, and one that we're really digging into with our content and with even with our data platform. Everything is about lifting people's understanding. People retain information 8 times more when they're having fun. And yet I would say that the vast majority of health education is delivered in a not fun way. and that's not really working. People's heart, you have to engage people's hearts, people's breath, before you actually engage their minds. When you do that, and if you do it in ways that they really understand and they can relate, then the doctors and the experts that we feature in our content, they're representative, because that's what we heard. We heard over and over again, we don't trust these doctors. We don't know them. We don't understand them. They don't look like us. They don't sound like us. And then they come out with very complicated gobbledygook. And that really entrenches families into saying, this is not trustworthy, right? So we're really trying to tip that around and really come to people where they are, and as they need to hear things and as they need to understand and experience things and co-create. People value what they co-create much more than what is imposed on them. So I think, digging into that so that we can gather fantastic data for our partners that they can then fold in to create better social determinants of health programming.
Great. Well, thank you for sharing such creative and important work. So Susan McLennan and Dr. Stephen C Moyo, thank you very much for driving change through your work in transforming complex concepts into accessible knowledge. Thank you very much.
Thanks for having us.